Hello, I'm Dr. C Gupta, Head of the Department of Vascular and Endovascular Surgery, Interventional Radiology and Podiatric Surgery at CARE Hospital in Banjara Hills. And nowhere is this combination more relevant than in treating patients with peripheral arterial disease. I have with me here Dr. Rahul, who is a vascular surgeon and specializes in treatment of patients with peripheral arterial disease besides other problems. Now, leg pain is one of the common symptoms that many people will experience during their lifetime. While it can be due to a spinal problem or an arthritis, while there are many causes of leg pain, one of the important causes is peripheral arterial disease, or a disease where the blood flow to the leg is reduced because of atherosclerosis or cholesterol plaques in the arteries. Dr. Rahul, how important is this disease?
The peripheral artery disease, now the most common cause is actually atherosclerosis. So atherosclerosis is a systemic disease, means it's not only the blockages which are there in the leg that the patient has come with leg pain, but this disease can be in the heart, that is the atherosclerosis can cause blockages in the heart to the vessel that is supplying blood to the brain, the one that is supplying to the kidneys and even to the intestines. So this is a systemic disease which affects the entire body.
So we are not just looking at a leg problem, we are looking at a problem which could actually result in a heart attack, a stroke, renal failure or hypertension.
Yes.
And even affect the intestines. So it is really a problem which needs to be paid attention to. And when a patient gets pain on walking, typically we call it claudication. Interestingly, the name comes from the Roman Emperor Claudius, who used to limp while walking. And typically we see these patients, when they get severe pain, they start limping while walking and they stop and the pain goes away and they start walking again. So it's a sort of symptom that comes with exercise and can be easily reproduced. What are the common symptoms or signs that the patient might have which should not be ignored?
One of the very important sign is, as you just told, the symptom that patient walks, they get a pain which is relieved within usually 2 to 3 minutes of resting. And when they walk again for the same distance, they get the same pain, as you described it as a claudication pain. So this is a common symptom. As the disease progresses, that is the blood supply to the leg is further decreasing, patients start having pain even when they are at rest, that is even when they are not walking. And sometimes it even disturbs their sleep in the night. So
I see.
What we call it as rest pain. And as the disease progresses and the blockages are more severe in the leg, the blood supply decreases, patients start having ulcers, and these ulcers don't heal. They can start having gangrene, they can start having discoloration in the toes.
I see. So it is really a serious problem, and peripheral arterial disease is potentially a limb-threatening problem. Not treated in time, it can result in a major amputation.
It can, yes.
Okay. So what are the treatment options available to patients for this disease? Are there any medicines which we can give when patients have claudication? Are there any surgical procedures, interventional procedures? What all can we offer to patients?
Well, there is a big spectrum with which we can treat this disease, ranging from the medicines till to the most advanced endovascular procedures. So to start with, medicines can be giving them simple antiplatelets. So these are the common medications which helps in improving the blood supply and alleviating their symptoms. But this is not going to change the blockages which are there. This will help the patient to decrease or control their symptoms.
So does exercise have a role in this?
Yes, a very important role is played by the supervised walking exercise. So in this, the patient is asked to continue walking. It should be basically to start with supervised so that they do it in a correct way.
Okay.
So this helps in improving the blood supply to the leg and it decreases their symptoms.
Okay. What are these surgical methods available? Now, typically, we know that patients who have claudication or pain on walking, we try our best to treat them only with medical management and exercise. But if the patient were to have advanced disease, for example, rest pain or toe gangrene, what we call chronic limb-threatening ischemia, where the limb is at risk, what are the options available for those patients?
Yes. So as you rightly said, patient with only claudication pain can be treated initially with medicines alone, and it has shown significant improvement, and they may not require any intervention.
Right.
Whereas the patient who reach a stage where they have rest pain or ulcers which are not healing or gangrene, in them the improvement in the blood supply is a necessity. So in them the open surgical procedures are like doing a bypass.
Okay.
So that the occluded part of the artery or the vessel is bypassed with a healthy vein or with a synthetic graft. Other advanced procedures, endovascular procedures, are angioplasty, stenting. Some places we can do atherectomy, in which we actually remove the plaque.
I see.
And there are certain areas where if there are blockages along with densely calcified vessel, we can even break those calcium and again regain the blood flow.
So you mean like lithotripsy for the kidney stones, where we break the stone using external waves? You can break the calcium in the arteries?
Yes, absolutely.
Yeah, very interesting. So this is what we call intravascular lithotripsy or IVL, where you break the calcium and sort of make them more amenable to angioplasty so that they can open up and improve the blood flow. Now, if a patient with leg pain comes to you, do all patients require angiography?
I won't do an angiography to all my patients with a leg pain. I would do an angiography in a patient in whom I am planning to do an intervention. Because if a pain can be managed, if I know that it is because of a blockage and it can be managed with medicine, then I will not offer an angiography to a patient.
Right. So just to put it in the right perspective, peripheral arterial disease does not mean that all patients will require a CT angiogram or an MR angiogram or any other angiogram. The decision to perform an angiogram is when we have decided that this patient is going to need some sort of intervention, either an angioplasty or an open bypass, which means the decision for angiography is based on clinical assessment.
Yes.
Are there any non-invasive lab assessments that we do to decide these things?
Yes. So one is the ABI, that is the ankle brachial index, which we do it in the clinic itself. This gives us how much is the pressure with which the blood is flowing to the leg. So it is compared with the patient's own blood pressure in the upper limb. So that gives us an assessment or an estimation that how much is the blood supply reaching to the legs.
Okay.
So that helps us in identifying the patient who has severe ischemia or moderate or mild.
So quite often we see that our patients are diabetics.
Yes.
And there the arteries are really hard and calcified, and the ankle brachial index may be very high even when the blood flow is less.
Yes.
So what are the other things that we can do to assess the blood flow in these patients?
So ABI can be very high in this patient, which is abnormal because as you said, they are quite hard, cannot be compressed to check the pressure. So in such patient, we can actually check the APPGs and toe brachial index, which gives us the pressure which is there in the toes, because usually these vessels are spared from the disease in the diabetic. And APPG is something like a waveform. So if a waveform of the blood, that is, you can feel your pulse. So it is a pulsatile waveform in the toes, which is usually normal if the arteries are only calcified but there are no occlusions. So that is a way we can identify.
Okay. So claudication or just leg pain and arterial blocks, we manage with medicine.
Yes.
And of course, we treat the risk factors. We give some antiplatelet medication, some statins to stabilize the disease, and some medications to help them walk better. And when it comes to severe ischemia like rest pain or toe gangrene, then we want to do some procedure to improve the blood flow so that the tissues can heal.
Yes.
Are there any lifestyle changes which you would recommend for these patients so that one, we may avoid these diseases? And number two, for those who have these diseases, can we reduce the risk of recurrence?
Well, in today's world, being sedentary is very it's next to smoking.
Yeah.
So I would say, first of all, chunk that sedentary lifestyle, go for a walk. So walking, then stopping to smoke. These are the two most important lifestyle changes. Other things which we can't change but the patient has is the hypertension, diabetes, hyperlipidemia, high cholesterol, in other words. So these are the things which we can't change but they can be controlled. So along with the lifestyle modifications, these things to be controlled.
I see. So effectively, what I would say is early diagnosis, early treatment, the right treatment would make a lot of difference not only to these patients' limbs but also to their lives and actually for the entire family.
Yes.
Thank you, Dr. Rahul.
Thank you so much.
Thank you.